We're going to be taking a look at number 20 on the UBC set of practice problems. An 18-year-old man is diagnosed to have suspected bacterial meningitis. He refuses therapy and returns to the college dormitory. What should a physician do in this situation? Now, you might encounter a scenario like this in your interview where you're going to have something that seems really medically obvious, right? You can have someone who has been diagnosed with something or may be suspected to be diagnosed with something, and they're just going to straight out refuse. Now, let you know right now, the correct answer is not going to be strap them to the table and just treat them against their will. That's not going to be the right answer. There's going to be a correct way to approach this, and we're going to see exactly how we can do that with this case. It's going to be a good one. It'll be nice and short, I believe, and it's going to be a good one. You're going to learn something in case you do encounter one of these, I'd like to call them medically obvious cases. So you have yourself over here. So you're going to be the physician. You are the doctor, and this could either be an acting scenario or it could be a discussion scenario. You may be discussing with the interviewer what you would do if you were the physician in this case, or you may actually be the physician who is going to be confronting the patient. So you may have one or the other. So what do we know about the patient? He is, I'm going to write patient over here. We know that he is 18 years old. We know that he has suspected meningitis, and we know he has refused treatment. So we have those three things. Now we know with to state our problem, right? We normally say this in our head. We don't actually say this out loud just yet. We state what the problem is, and that's going to allow us to ask the right questions to collect the right information. So what is the problem in this case? Well, what is meningitis, right? Meningitis is the swelling of the membrane around your brain and around your spinal cord. And it's the fluid that's there is supposed to be free of bacteria. So if you actually have bacteria in there, well, inflammation is going to occur because your immune system is going to be trying to get that bacteria out. And that's really dangerous, right? You can't have the membrane surrounding your brain or your spinal cord to start swelling due to inflammation. That is not what we want. So it could be dangerous, right? So man has suspected meningitis and is refusing treatment. What do you do in this case, right? You're this person's physician and he doesn't want treatment. So let's go ahead and collect the information. What are some questions we should ask, right? What are some things we want to ask? Well, it says he has suspected meningitis, right? So maybe there's a chance he doesn't have meningitis, and maybe a few tests can, just cross these things out and we won't have to worry about this person, right? He doesn't want treatment for whatever reason. We'll find out in a moment. But, does he even have meningitis, or what can we do to actually solve it? So which tests can confirm the diagnosis? Maybe a few quick tests, right? It won't even take much of his time. A few quick tests will allow us to determine whether or not he actually has meningitis. We won't get into details, but we can just say which tests will we need to do to actually confirm that he has it. Maybe if he finds out that he actually does have it, that will change his perspective. So we'll start off there. We know he just has suspected meningitis as of now. How can we go ahead and actually confirm whether or not he has it? So we're going to go right there. So we can go on to the next question. You want to, ask yourself, right? If this is going to be a discussion-based interview, you can actually ask these questions out loud, as I mentioned in the past. So you can say, what are the consequences of untreated meningitis? Well, as I mentioned before, if your brain and your spinal cord are swelling, fatality or death, that's the possible side effect, if you want, of meningitis. So that's having him go untreated is definitely not going to be a good option. So we have all that here. We collect this information here. So let's go ahead and actually think back to the time that we were talking to this person, right? Or the time that is being referenced inside of this case over here, where he just refuses treatment or refuses therapy and returns to his dormitory, right? Why did he refuse? Why did he refuse treatment? chances are he didn't just say nah bro and leave, right? He probably said something, either he wants to go take a nap, or he doesn't think you're right, or he doesn't really care. There's got to be a reason why he said he doesn't want treatment. Whatever it is, we should have that information. It's going to help us understand his reasoning. We'll go down here and says, does he understand the consequences of untreated meningitis? Right? Did he even understand what could happen if he did have meningitis and he wasn't treated? Right? That's another option. Something else you have to ask, and it's going to be, filtering in or assisting us in the solution process as we move down the solution pipeline. So, does he understand what the consequences are? And one last thing, is he competent? Or I guess I should say, was he competent? Competent when he refused treatment. And we talked about whether or not a patient was competent in the past, and we're going to talk about more of it as we progress through this series. Did he, was he able to understand the consequences of his decision? Was he able to understand, what he was saying? Possibly was he drunk at the time? I'm just showing an option for an 18-year-old, right? Was he drunk? Was he at a party? And he was just in here and he really wasn't understanding what you were saying, and he just said, I just want to go take a nap, and he just left. If you can't really, you got to allow your patient to make their own decisions. But if they're not competent decisions, if they're not competent while making the decisions, they can't understand the decisions they're making, well, you can't really take into consideration what they're saying at that time. That's one thing to consider. Also, if there's a possibility of mental illness. So just, keep those two things in mind over here. You can go ahead and write drunk or mental illness. So saying, is he competent, will cover both of those things. So you don't actually have to go and mention them. Or you can mention them if you want. So now we go ahead out loud and say the problem, right? We have to figure out what the problem is. This is when you're going to say a patient is suspected to have meningitis, which could be fatal if not treated. Which can be fatal. He refused treatment. Okay, so now we're going to go down to where we actually go ahead and write our solutions. So what are going to be the possible solutions for this situation? What can we do here? Well, we know that we're going to have our extremes, right? What's going to be extreme number one? It's going to be let him go. Let him go. Leave him alone. Right? He said he didn't want treatment. All right, I trust him, right? He seems like a good guy. He's 18 years old. He knows all about these things. Just let him go. Let him do his own thing. I won't bother him. He doesn't want to hear from an old physician like me. He just let him do his thing, right? That's number one. Number two is strap him to the table and force treatment. Oh, or seriously, I mean, like that would be just, forcing treatment on him, right? He says he doesn't want treatment, but that he's going to be, it's going to be bad if he doesn't have treatment. So you can go ahead and force treatment on him. That's going to be the other extreme you have over here. One more over here. Go ahead and say, inform him. I wouldn't even say inform, right? You can go ahead and, if you're approaching the situation like this, you have to know or understand the person you're talking to, right? So go ahead and say, ask him what he knows about meningitis. Educate him if he doesn't. Doesn't know. Let's go ahead and add a fourth option here just for fun. Directly contact parents. There we go. So that's the four solutions here, right? We have two extremes and then two over here. So which one is going to be the correct one? So as we know, once we have our solutions written out, now we want to go ahead and cross them out. So what's wrong with some of these? Well, let him go right here. Well, just because, we haven't confirmed he has meningitis, we do suspect he has it. So if we suspect it, there's got to be some reasoning behind that diagnosis. So chances are if we just let him go, it could be really dangerous for the patient. He is our patient. Although he just refused treatment, it doesn't mean we just give up right there. We are not going to obviously force him as we saw over here, but you can't just let him go, right? No concern for well-being. Which is one of the top concerns of a physician is to make sure that his or her patients are healthy. Letting them go is definitely not going to help that. Well, while you're sitting in the room with the actor, you're just going to go ahead and strap him to the table and begin treatment for meningitis. That's probably going to get a lawsuit against you in the first place, and it's just you no respect for patient autonomy. Everybody has the right to make their own decision. This is assuming that he was competent at the time. He does technically have the right to make his own decision. Now, we can't just go ahead and strap him to the table, but we want to find something in between these, right? We do want to, we don't want to give up right now, but we don't want to just go ahead and force him. So a good option is going to be to actually go ahead and talk to him and ask him what he knows about meningitis. Maybe he just thought meningitis was an allergy or something, right? Meningitis, some people don't know what that is. He just thinks it's some allergy is going to cough a little bit more during the fall and then he'll get over it, right? Maybe he just had no idea what it was. So if you educate him about what it is and then tell him, if you ask him what he knows, and if he tells you what he knows, maybe it's just completely incorrect, tell him the correct answer. There's a good chance that after you tell him, the consequences of, possible, consequences of not treating it, maybe he's going to say, okay, and he's going to agree for treatment, right? Because now you are respecting his autonomy, you're allowing him to make his own decisions, but making sure he's making those decisions based on actual information and not something he may have heard from a friend who heard from another friend who read it on Google one time when pressing the I'm feeling lucky button to go to the first page, right? You don't know where he actually has this information, so you want to make sure he is allowed to make his own decision, but he can't make it. It's got to be based on actual facts, right? So he's got to know it. Let's take a look at this last scenario over here, which is directly contact the parents. Now, this is a curious one, right? Because I would cross this out in most circumstances, but the one time I would actually accept this, right? Or I would say that this is going to be a decent answer. Let's go ahead and write this. Was if he was not competent. I would go and contact the parents. Remember, he is 18 years old, right? He is able to make his own decisions, right? He is, the medical system views that he is able to understand the severity of the decisions he's going to make. He's able to make decisions regarding his own health. So, going and contacting the parents if the kid was competent, it's just not something you do, right? You're going to go ahead and talk to the kid and not go ahead and talk to the parents. But if he was deemed not competent, right? If he was drunk, or once again, a mental illness, whatever that may be, that's a circumstance where I would actually go and contact the parents. So there could be two possible pathways for this, right? Whether or not he's making this decision to refuse treatment because he just doesn't understand what meningitis is, well, that's this pathway over here. Or if he is just drunk and doesn't really care what you have to say and wants to just go nap or go eat some food or some pizza. Pizza sounds good right now. Then maybe, you got to go with this other pathway over here. So there are two correct pathways over here. So what would you do in either of these pathways, right? Well, this one over here, we would talk with this first one over here. We'd approach the patient and ask what he knows. About meningitis. What does he think will happen? What does he think will happen? What does he think the consequences are going to be? Correct? Any misinformation? Ask him again. Ask him again. Now, in most circumstances, right, somebody, once they have all this information, they understand how serious meningitis is in this specific example, they're going to come with you, right? And in the event that they don't, well, then you're going to have another situation, which is, why? Right, simply why? Why do you not want? He can't just say why for no reason. He'll give a reason, and you'll have to work based on this. But I would say, this may be like less than 5% of the time you'll have to go with this pathway. And the other situations you're going to go the 95%. He'll say, okay. Now that you've given him all the information, he will say okay, and you'll go back to the office, and you can begin treatment for that. Now, what about this situation over here, right? The one where the patient was not deemed competent, right? The one where we directly contact the patients. What I would do is I would see the patient again and assess whether or not he is competent. Well, number one, the drunk, well, that's just, there's not many things you need to do to test that, right? You can normally tell these things, right? Scent. Does he smell of alcohol? Basic tests. Things that police officers do to detect whether or not you're drunk driving. Even a breathalyzer. I don't know how to spell that. So breathalyzer would be another option available. So, those things, test if he's drunk. If he is, contact the parents because you probably want to get the treatment started as soon as possible. But if this patient is drunk, he was definitely not able to make the decision on his own. You should definitely have a family member who can act in his best interest. Now, number 2, mental illness. What would happen in that case, or how would you figure it out? Well, we're assuming that you're the physician of this patient, so you probably will have the records of him. You can check his files. Check files and see if he has any history of mental illness, if there's something listed and he is acting, irrational based on decisions he's making. You've tried to inform him of these things that we talked about over here, and he just doesn't seem to care. There's a good chance that he is making those because he doesn't understand. If you rule that he doesn't understand the gravity of the decisions, or he doesn't understand the consequences of the decisions he's making, well, that's when we can go ahead and contact the parents, which, it's that maybe not directly contacting because we are going back to the patient to see why they're making these decisions, but that's an option available to us. So we have these 2 pathways. I would say for the most part, this pathway over here is going to be the correct one. In some cases, maybe competence comes into the discussion, and we'll see more cases regarding competence as we progress. If you have any questions regarding this scenario, please leave a comment below. I'll respond to you as soon as possible. We can discuss it in further details if you want. I'll see you guys in the next video.